Hello and welcome back to Semester 2. Our first 2 weeks of simulation activity will involve a clinical activity around using the Dominion Explorer. So you will be timetabled into at the LRHS Dental Clinic sometime over the next 2 weeks to complete exercises in Dominion probing. With probing comes a risk of bleeding of gingival tissues and possible bacteremia. We call this an invasive technique. It's not usually dangerous. However, if you have particular types of medical conditions, it can pose some risks. For that reason, we're asking that you complete a medical history form. This is a form that we use in the Bendigo Health Clinic, and it's one that you'll be using when you have your first clinical experience with patients. It's fairly straightforward, and whenever you visit the dentist, you will have completed something like this. There are a number of questions that you're asked to respond to with a yes or a no, so you're asked to circle yes or no. However, some of the questions contain multiple conditions that they ask about. For example, the question, have you ever had any type of heart disease, heart murmur, blood pressure, or rheumatic fever? All of those conditions are sort of related. That's why they're in the same condition, but they're actually distinct conditions that are different from each other. So if you had a history of heart disease, a heart murmur, or rheumatic fever, then there may be some risk for you with invasive procedures. But if you had high blood pressure, for example, the risk from invasive procedures there is no risk. But there could be additional issues around high blood pressure episodes in the clinic, which may lead to medical emergencies. Or if you do have chronic high blood pressure, then you may be taking medications which we need to know about because they can interact with other medications or may have implications for planning dental care. So if you answer yes to that particular question, we would ask you to also circle the particular condition that you have. Rheumatic fever, a history of rheumatic fever, or blood pressure. Those things are quite different. So just indicate on the sheet which of those conditions you're responding yes to. If you were taking any medications for those conditions, on the second side there is a table here for you to record those medications. There is a column here which asks you to name the drug. The second column here asks you to indicate the strength of the dosage, so for example 10 milligrams. The next column asks you how frequently you take that and uses a per day requirement, and when the last time was that you took that particular drug. So you will have this form at home, and hopefully you'll have your medications with you, so you'll be able to transpose that information quite easily. There's also a section on this side of the paper that asks you to indicate the name of your medical doctor, so you've got time to call home and ask about that. Bring this along, so print this out, physically fill it out, and then bring it along to your first clinical session when you are rostered to do the Dominion probing exercise. If you have any questions or you're anxious about putting information on this sheet and bringing it along, please email me, personally email me if you have concerns about the information that you're being asked to include in this form, if it's of a personal nature. If it's a general question, then place that on the LMS forum, because if you're asking it, then it's likely that other students are thinking that as well. So if you could complete that and bring that along on your first session in the LRHS clinic, that would be great. Thanks very much.